What is pacemaker? How it is done? When it is required? This question may be there. So let's understand this too. Namaste. I am Dr. Sanjeev Kalkekar, Interventional Cardiologist, Apollo Hospital, Navi, Mumbai. So friends, our heart beats between 50 to 100 beats per minute. When heart beats less than 50 beats per minute, it is called as a bradycardia. So sometimes it could be natural phenomena like those in athletics, they have a low heart rate, but sometimes it could represent disease process due to age, due to sudden heart attacks, or sometimes due to the electrolyte disturbances, your heart rate may be very low. And in such cases, you may require a permanent pacemaker also. What is permanent pacemaker? In this patient, what we do, we put such a permanent pacemaker. Now, these pacemakers are fitted by doing surgery below the collarbone and they are fitted below the skin. And one lead connects this pacemaker to the heart. Now, these pacemakers are very smart devices. They see whether your heart is beating or not. If they find out your heartbeat are not sufficient, and this pacemaker in that case support your heart by giving the extra pulse, extra beat to the things. These are called the surgical pacemakers. Now, once this pacemaker are fitted, the benefit is that they help you, they work for at least 10 to 12 years. After 10 to 12 years, we have to remove this battery and replace with the newer pacemakers. That is called the battery replacement. Now, precaution you have to take. Nowadays, we are getting MRI compatible pacemaker, so you can go ahead for the MRI. But wherever you need to avoid the electromechanical conduction which are there, we have to avoid such things. Now, you may ask, is there any new change in the pacemakers? Yes, some new changes are there in the pacemakers. So, with this conventional pacemaker, one problem was that during the surgery which you do, there could be sometimes hematoma, there could be infection, there could be some damage to the lung, there could be problem with the lead fractures. These problems were there. To remove this complication, the newer technology has done, and this newer technology is called as a micro pacemaker. You can see such a small pacemaker. So these pacemakers are 93% smaller than the conventional pacemakers. And these pacemakers, they doesn't require any surgery. So no surgery here, no lead also. So what is required? We can just implant this smallest pacemaker inside your heart via the transcatheter technique. So from the right thigh, we pass one vein, via the vein we pass this catheter and direct into the right heart. And so this can be implanted direct into the right heart. These are called as a micro pacemaker. You can see the size change with these pacemakers. So those patients who have tricuspid valve disease, those patients who are undergoing regular hemodialysis, those patients who don't want surgery, who don't want bump here, they can undergo for the micro pacemakers. Again, those patients who have infection over both the part and they don't have any place to put, in such patient again micro can be implanted. So this is all about pacemakers. Thank you.